My role as a manager of the Resuscitation Service for the Trust with regard to the Safer Patient Initiative campaign is, as well as providing education and training for healthcare professionals with regard to cardiac arrest, is providing education and training in prevention, so recognition of seriously ill patients and early treatment and recognition preventing cardiac arrest. Nationally, there is a drive for resuscitation services to provide this type of training. The way that the Resuscitation Service here have had to implement that is that we've implemented the early warning observation charts into the Trust, which has now been used by the Safer Patient Initiative to aid nurses in recognising sick patients on the ward areas. The early warning scoring chart is based on basic observations that all ward staff perform daily, even hourly, on patients on the ward. Predominantly, these are carried out by the healthcare support workers in the Trust. And what we found, that observations were being recorded, but there was sometimes a lack of, not knowledge, but a lack of confidence in reporting these abnormalities. So we've used the National Scoring Chart of Scotland, which has been introduced into this Trust, and it's basic observations: respiratory rate, oxygen saturations, blood pressure and heart rate. It's a colour-coded, aggregated scoring chart, so that when a patient triggers a score based on the observations, if it's 3 or above, then a response is initiated to either call medical personnel to come and see the patient, or in the Heath on certain wards where the medical rapid response team are, to call them. For patient change, I think our overall aim is that if patients become sick, that they are picked up early on the wards. Even though sometimes patients don't suffer a cardiac arrest from missed medical and nursing care where they haven't been picked up to be sick, even if they end up going to intensive care, the research has shown that if they go to intensive care too late, then they may not survive to come out of intensive care. I think the 1,000 Lives campaign has been received exceptionally well. Change is always difficult, and to introduce something new as it is very difficult in a trust of this size. However, I think with the champions and that people driving it forward and the approach that's been taken in the structure and the way that it's been pushed through the Trust has been very effective. And I think that now we're finding that people on other wards want to be part of the implementations involved. From my point of view, from the resuscitation and the early warning scoring charts, I think wards want to be part of this because they want the confidence, they want to help patients, and they want some support to help them when they're handing over patients, that they know the patients are sick. They want a structure and a system in place that will help them contact the medical team to say that the patient's sick. And I think everybody wants the best for the patient, and wards are busy. I think the 1,000 Lives campaign is important for safety, overall patient safety across the Trust, and continuity of care, so that patients are receiving the same care in the same areas. I think frontline staff should be involved in the 1,000 Lives campaign, because overall we're here to care for patients and ensure that they are remain safe and they're cared for to a very high standard within a hospital.